Welcome to episode 109, Will My Client Hurt Someone? A Primer on Risk Assessment, featuring Robert Scholz, licensed marriage and family therapist and licensed professional clinical counselor. Make sure to subscribe to be alerted about future episodes. By Clearly Clinical, learn, grow, shine. Hello to our listeners. Today we are joined by Robert Scholz. He is a licensed marriage and family therapist and a licensed professional clinical counselor. Robert and I have had the pleasure of working together for years. He's in private practice in Southern California and has a very unique specialization in crisis management and threat assessment and risk management. And Robert, thank you for joining us today and sharing some of your knowledge on basically how we address and manage threats in our particularly child and adolescent and young adult clients.
Well, thanks for having me. And I know it is kind of a topic that is a hot topic in the world and one that I think people are interested in. I sort of came into this work, I think, through a number of different experiences, in my career, and have really found that it is kind of whereas sometimes these events happen that, we sort of walk away like, how did that happen? How did we get to this place where we're seeing that there are these acts of violence that are carried out on school, college campuses, workplaces, and at times there's sort of this idea that there's no sort of explanation for it. It's just sort of random violence. I think part of what I hope we can talk a little bit about today is that while you can't necessarily predict everything, there definitely are some things that we as professionals can be looking for. Also things just that parents can be looking for to kind of help keep their kids safe. If there are signs that are popping up that they may be at more at risk to commit a violent act, of ways to intervene. And that's the part of the work I enjoy is kind of, we'll talk about threat assessment today, but also threat prevention. And, because I think there's probably too little discussion about that part of it. And that's a part where I think people can come together on, rather than always kind of being in the reaction mode or following up after the crisis has happened.
Thank you, Robert. Why don't you tell us a little bit about your training and background, particularly in this crisis and risk and threat management field, because it's something that I think is unknown to many, but is really critical to the work that we do.
Yeah, I think, like a lot of the things that we mental health professionals get ourselves into, I don't think it was something I in graduate school sort of imagined myself doing. But I think through a series of experiences and actually a kind of number of different fields, sort of eventually evolved into this kind of work. So I have a pretty long background in the forensic mental health world, specifically working with populations of adolescents and adults who had acted out sexually and violently. And so that kind of early in my work introduced me to the field of risk prediction. And when we were kind of coming to terms with how do we figure out who's at, like those people that get themselves involved in the criminal justice system, who's really at higher risk to reoffend. And so it kind of exposed me to this idea of, oh, wow, there's actually this field where people are studying how to put variables together and really kind of creating these really sophisticated models of risk prediction for people that had histories of acting out. Okay. And so that's one field and kind of then introduced me to that. And then I spent a long time in university mental health and working on a college campus where, amazing work, really gratifying work. And at the same time, it's a place where a lot of crises happen. And so pretty soon after I got into that field, I was asked to go and do some more kind of deeper dive training into crisis management, responding to disasters on college campuses. And so it's been kind of an evolution in terms of how my different sort of experiences have kind of dovetailed into each other. And part of that work on a university campus is that, inevitably there would be threats of violence, some which were serious and really needed a very serious response, and others which were, less serious, but needed some sort of intervention. And so I have a lot of interest too in kind of understanding, first of all, these things don't happen in isolation. And so threats and crises not only sort of affect the person that has made the threat, but there may be the person, there's obviously the person that they've made the threat towards, but also all the other people around it. And kind of knowing how to, realize that many people are affected when risk or threats happen, and how to respond, how to help systems develop a really effective response so that, the needs of the larger community are taken care of. When we look at like school shootings, it's like, there's oftentimes a focus on the families or the victims of the shootings, but then there's all the other people in that community or in that school that, like, sort of figuring out kind of how to respond to what their needs are post-crisis is also part of the work I do, and helping systems kind of figure out what is needed.
I am glad you bring up that piece of the community at large and the system. I know you and I have both been through that here in Thousand Oaks, where we had the borderline bar shooting in November of 2018, and seeing just the fallout in our community, how significant that's been for all of us, not only as mental health providers, but as community members, and how scary. I think you're right. We really focus a lot on the victims or their families, but it's this impact on the community at large. And someone like you understanding how all those pieces fit together when the rest of us are kind of thrust into this, not really knowing how to respond when these bad things happen. And then, as you brought up, prevention. So why don't you start by telling us really about the field of threat management? Like, really, what is that? Because it's not something I think that many of us really know much about.
Well, and it's a relatively new field. I mean, while there's always been threats, and I think for many, many years it was a field that was oftentimes reserved for like law enforcement folks. And so, police, and other law enforcement, professionals, they were typically the main people that were involved in sort of managing like a threat situation, and having relationships with lots of those, folks. I mean, they have, some of them, that's sort of what they specialize in. They have amazing training in. But I think as sort of threats and situations have evolved, there's kind of an appreciation that there's probably a need to have multiple perspectives at the table. And so I think you started seeing more psychologists get involved in the work over the last 20 years, and really an appreciation for, this idea of having a threat management team, whether in a workplace or in a university, really does need multiple perspectives. It's one of the dangers, I think, is sometimes if one perspective takes over, we're all biased. And so I think the idea of threat management is having multiple people that have a stake in the situation be able to sit down and have some sort of guided process, in a systematic process to really identify the situations or the person of concern, figure out kind of how to investigate or gather relevant data about the situation, how to interview a person that has made a threat or those that have been threatened, to really gather the relevant data, and then to kind of use that data to make an informed decision about how to mitigate the risks involved, and then come up with a management plan. Because, while there are some situations that are, may lead to an immediate sort of expulsion of the person making the threat, there are also many other situations where that threat may not reach the threshold where that is the outcome, especially when you're talking about kids and teenagers and even college students. The truth is that, when people are younger folks, and I would even argue that some adults, sometimes we make really, really crazy, stupid comments that come from a really emotional place, but that there's really not necessarily an intention that we're going to follow through with it. But then it's kind of like, how do you live in community or in a workplace with someone that maybe they aren't really deemed to be a high risk, but now I have to live around them? And how do we manage that kind of situation? So you need a process. You need to kind of figure out how to take everybody's perspectives into consideration. And that's really what threat management is about. It's a process. It's guided by some rules and some guidelines to really help, like I've kind of alluded to, like a management team make some of the best case decisions for the community in which the threat has occurred in.
When we're looking at the goals of a threat management team and a threat assessment process, what are we really looking to achieve?
Well, I think there's a couple different things you're probably looking for. I mean, one, of course, is you're trying to get hopefully a good assessment of the true riskiness of the person that's made the threat. And so whether that's an individual or, in some situations, you'll see more than one individual make a threat, or a group is a threat to another group of people. But it's to really try to get the best assessment of how serious of a risk is this. But then it's also, again, and I'm kind of, because most cases are not always super clean in terms of if this is really severe, this person, or the threat has been acted on. It's trying to figure out what are the needs. So both a risk and needs is part of the work of a threat management team to lower the risk factors. And so, whether that means, the person that's made a threat and, it's identified they have some, significant mental health issues, or there's substance abuse concerns, or, whatever it is, how to lower those risk factors, as well as maybe even bring into the equation some guidelines about contact between persons. So, oftentimes I'm asked to do like a threat assessment of a college student. And so, and in many cases, I would say probably in half the cases, it involves, a student who has either made a threat, of violence, or, or is involved in some sort of inappropriate level of engagement with another student, like a stalking behavior and whatnot. And it's in those cases, again, there's a range of seriousness and severity, and it's really important to take into consideration everybody's, position on the situation. But oftentimes, even if there's maybe been a suspension, or some sort of punitive action, oftentimes, they are still maybe living in community with each other. So how do you lower the risk factors? Or if the person is suspended, how do you put a protection of order in place, and monitor that and kind of make sure that takes place? Ultimately, you're, and especially with young people, and this is, I think, where it gets a little harder. It's like we're trying not to, the 11-year-old or even the 15-year-old that makes a threat. We're not trying to kind of get to a place where we're unnecessarily labeling them as this dangerous person who now should never, should be sort of kicked out of a community, because that's probably not helpful for most of those kids. At the same time, you want to prevent harm. You want to hopefully increase the person's skills to know how to manage, their emotions better, but also really trying to make sure the people that maybe had been if there was a specific person that had been named, making sure they feel safe too. So there's sort of, these get tricky in cases, especially in school settings, because you can imagine, you have parents involved, and, parents are going to find out that there's maybe been a threat or something made at their school, or, even more specifically against their child, and how that's going to be managed in a way, while you also have the person that's maybe made the threat that is, has their own parents and their own perspectives on what's happening, and doesn't want to see their kid, be sort of, excluded and kicked out. So it's this really tough balancing act that I think threat management teams play. And yet it's so critical, because when you talk with students, I was thinking of a situation more recently where I wasn't involved with either, the intended victim of a threat or the perpetrator of the threat. But I was just involved with a kid who had been a student at the school where the threat had gotten out, and had sort of been broadcast over social media. And so, so this kid was just trying to kind of figure out, am I safe? And so, what information is the school going to share with me about this? Because even though I'm not the person they made the threat to, I'm not feeling safe now, and I now feel the school owes me some explanation for what's happening here. And it obviously challenges things like students, rights to privacy and, confidentiality and all those sorts of things. But in today's world, that's oftentimes, you will have some sort of what, it's oftentimes referred to as leakage, where, knowledge of a threat comes out. And what do schools do to reduce the impact of that and manage that?
So it sounds like you're saying, obviously this is very complicated because you're managing both what's happening with the perpetrator of the threat, but then also potential victims or just other community members. So when we're looking at the overall process, it's first starting with, as accurate as we can, an assessment of the riskiness of the person that's made that threat, evaluating the risks and needs of that person, addressing the risk factors, assisting the person who's been threatened and been affected, and then preventing future harm. That's a lot of consideration.
Yeah, right. Yeah.
That's quite a list. Like there are a number of factors there. And I know for me as a private practitioner, these concepts are scary because in California, we have laws that are very explicit about basically when you can cross that line, when we can break privacy and can contact the authorities, and not only can, but almost when we're necessitated. And so when you're talking about those more nebulous situations, I think a lot of us have no idea how to even begin to address that. So if we're talking about a client and risk of suicide, we can pull out certain questionnaires and we know who to call. But this whole idea of the other side of it, of a threat of harm to others, I think is something that a lot of us don't have very much information or training about.
Yeah. And I mean, even though they're things that we clearly are, when we take our state licensing exams, we're asked about things like TerraSoft, and we're expected to know about that. But I do think, I don't know that it's been intentional, but I think there's been a lot of emphasis and awareness raised with mental health professionals about the importance of knowing how to do an effective suicide assessment, and probably less emphasis in training on how to do a violence assessment. Mm-hmm. That tends to be sort of reserved for, I think unfortunately it's fallen into folks that do forensic psych evaluations, or people that kind of work in populations of folks that have been violent, rather than sort of just kind of viewing it as, and we know that people who, there's a certain group of people that are suicidal that also are having thoughts about hurting other people. That, it's not the large majority, but but I do think it's one of those topics that I think I don't think you're alone, and I think it's for many that they get scared about what's going to happen if I find this out.
I agree. And to explain for our listeners that aren't in California, Tarasoff was a case. It was Tarasoff versus the Regents of University of California in the 1970s that created a law that made it so that mental health professionals are mandated to report under certain circumstances when there is an identified victim of some kind of potential risk or threat. And I know other states have similar laws, but then for me, it's kind of this situation that is scary and tenuous because I don't know what I would reach for. So thank goodness for people like you that have a specialization that can share it and say, here's what you need to be looking for. So why don't we start by talking about those kind of red flag behaviors? What do we as practitioners need to keep our eyes open about and our ears open for?
Yeah, I mean, I think there's some pretty more direct ones that when you hear them, you're going to be like, oh, well, that makes sense. And then I think there are sort of some more of the indirect factors. But I'll maybe kind of talk more specifically about some of the ones that are absolutely critical. And these are definitely some of the items that are utilized in some of the structured interview assessments that we do, which we can maybe talk a little bit more about later. But, I think the first one is very simple, is that if someone is communicating any sort of direct threat of violence towards someone and has any sort of plans, and so it's like the question of, do you have any plans, or desire to hurt another person? It's a very direct question, but if you're hearing, you have a client come in your office and they're going off on, another student in school, or they're going off on a parent, and you're really picking up a lot of anger, and they're using language that seems pretty violent, you're going to want to dive into that and, acknowledge, thank you for, letting me know, you're really having some strong feelings about Johnny. And such strong feelings that, I'm just wondering, what your thoughts are and what you think you might do to Johnny, when you leave here today, or between, now and the next time we meet. Like, not being afraid to go there. But when people are to that point where they're verbalizing direct threats, it's really important to follow up on that. Now, we might be saying, well, duh, we would do that. But I think there's a lot of ways we sort of get around wanting to go at that. And I think it's that, well, I've known this client for a long time, and I know they're not violent, and we sort of rationalize not seeing the potential for the violence because we know them, when the truth is, we have to kind of look more. This is when I think sometimes it's kind of like when you're in any other kind of crisis situation. There's sometimes a place where we're challenged, where we have to step out of our role as a therapist and doing therapy, and we move into kind of a place where we're having to evaluate a little bit more. And that's tricky, and that's sometimes hard. And it's kind of like when you have to do a suicide evaluation with someone, because you're needing to gather some specific information, not only to keep your clients safe, but potentially other people safe, which is sometimes tricky. So I think there's obviously the direct communication. It's something, and sometimes you just have to ask about it. And so sometimes they may be alluding to it, and it's kind of like if somebody's alluding to suicide, you need to ask directly and not be concerned about, well, I'm going to plant this idea in their head. If it's there, it's there. And just like suicide, I find sometimes when people are in that kind of a really violent mindset, like just being able to open it up and talk about it helps to begin the process of mitigating some of the risk, or getting them to a place where they're not going to act on it. I think the other thing is just the other one that's a big one. Again, it's going to sound obvious. It's just, do they have access to weapons? Do they have access to how they would what they're talking about doing. And so it's not only, especially if you're dealing with a minor, but I would argue even with an adult, it's asking them directly. So, if they're making comments like, I'm going to go stab this person, or I'm going to go shoot this person. It's kind of testing that out. It's like, well, tell me about your access to guns right now. In your house, what do you have access to? Outside your house, if you wanted to get a gun, how easy would it be for you to do that? Where would you get that from? That sort of thing. But I also think it's then, needing to kind of figure out a way to get some collateral data from others around the person, because sometimes they're not going to be completely honest with you. And so it's asking parents, are there weapons in the house? And, oh yeah, we have them, and they're locked up and they're in the gun safe. And, who has the combination to that safe, or who has the keys to the safe? And, just how safe is that safe in terms of keeping them away from those weapons? I think also just kind of the idea of how obsessed are they? So it's not only do they have the plan or access, but how developed is their plan? How obsessed are they with this? How much have they been kind of playing this out in their head over a period of time? And so, simple questions like, how long have you had these thoughts? What level of detail do you have about how you would, this would play out? Trying to get at how developed is the plan, or is it just kind of in a I'm pissed off at this person state, and really not into a full-blown plan, how I'm going to implement this thing state. It's really important to discern that.
So when you're looking at the development of the plan, in terms of any research, is there a correlation then between the development of the plan and how detailed it is, basically, and the likelihood that there could be then some violent act?
Yeah, I mean, I think, one of the myths that we sometimes think, well, these things just kind of happen. And when they've kind of done sort of a in-depth analysis of school shootings or workplace shootings, the overwhelming majority of the time is that they see that there was actually a lot of planning involved. There was a lot of research involved. And so again, what I can say is that, the only data we have is when sort of a postmortem analysis is done of these kind of cases, and they've gone back and they can usually see that, oh, wow, there was a lot. And not only was there kind of looking at how to do it, but they may have had some trial runs. They were really kind of trying to even work out the kinks in a plan. This wasn't something they just sort of arbitrarily woke up one day and said, well, I think I'm going to go take a gun to school. Usually there was a lot of advanced planning.
So what do you do in the cases where you have one of those clients that, let's pretend, is the one that's made the threat, and you're trying to evaluate in session with them, but nothing is overt enough where it's, reportable? And obviously for our listeners, that's dependent on what your different state laws are, but we're not in the realm of a duty to report. We haven't crossed into that line. What do we do as practitioners when a client says, yeah, I've actually been doing a lot of research about XYZ weapon and how I could be utilizing it and when it's most efficient? And what is our correct response as a practitioner that does not have specialized training in threat management?
Well, I think it's like we do hopefully in other situations where we kind of start to feel like something's a little bit out of our league, or is not in our area of expertise. We sort of have people that we can call up and consult with, and you can get another perspective on it. In California, we have our California Association of Marriage and Family Therapists, and they have a legal response, great group of professionals that we can kind of call and run a scenario by. I think, if in doubt, I think, the worst situation to be in is sort of having a client leave your office with doubts. And so I think, in some situations like where, and I would say that most of the times this has been with minors or college students that I've had to do this, is, it's kind of like I need to kind of let somebody know that you're struggling, and I'm not comfortable with you leaving here until I know, because I appreciate your honesty. I appreciate what you're telling me. And to help keep you safe and to make sure others are safe until we kind of understand this a little more clearly. I've got to get some other people involved to help this feel like it's okay, and help me feel like we're in a good place. And it's tough because, you run the risk at that point. They may shut down on you. They may not want to talk to you further. But I think it's always like, where do you want to err? Do you want to err on the side of not doing enough, or do you want to err on the side of, maybe a little bit of an overreaction? But I would argue that when you're trying to keep people safe and you're trying to get more information, I would rather err on that side. And even if it means I kind of have to, really talk, because otherwise then it's if it's really questionable, if I have some really outstanding questions about, is this person going to be safe? In some situations, am I going to need to call like a county crisis team, to further assess them? And I might need to do that. Or if I felt like there was some immediate danger and they were kind of being maybe a little gamey with me about access to weapons or where they were going when they were going to leave, or became, maybe more enraged in session where they were kind of becoming a little more uncontrollable even in my presence. Again, kind of needing to create the safety. And, as many attorneys have told me, always err on that side. It's harder when you let something go and then you have something, a mass sort of disaster happen.
I think it's a really scary consideration for every clinician. Whether we're talking about risk of violence to others or self, it still opens up this can of worms, I think, that's terrifying for all of us, in not wanting to misstep, wanting to be as careful and as prudent as we can be to reduce the risk not only to our clients, but to other people around them. So you had mentioned kind of some of the things that we'd be looking for. So how detailed is their plan? Do they have access? I mean, I know one thing that comes up for me in talking about this, I remember in UC Santa Barbara, the use of a car as a weapon. And so it also, that for me opens up its own can of worms of like, many of us have access to things that could absolutely be dangerous for other people. How do you assess that? And what are some other red flags and risk factors that we need to know as clinicians to be keeping an eye out for?
Yeah. And like you're pointing out, it's the range of ways people might go and hurt someone. They're sort of what we would think are more the obvious common ones. But then there are other ways people could hurt someone. So, you do your best, but you want to kind of go through, and then as you maybe go through some of the more obvious ones, then you ask maybe more of an open-ended question. I've mentioned some specific things about ways you might hurt other people, but, are there any other things you've thought about in terms of how you might hurt people, that I haven't brought up so far? And of course, you're sort of relying on them to fill in the blank, but at least you've given the opportunity for them to speak into that a bit more. I think kind of some of the other risk factors, I think some of the people really holding on to resentments and grudges, sort of keeping a list. And we've seen that in a number of the shooters, is they've sort of had a list of people that have wronged them. And so if you're kind of hearing that, and again, people get hurt. It's not that in therapy, people talk about people that have hurt them. That's one thing, and that's great. And in most cases, that's a cathartic thing for people. But it's that kind of over obsessing on it, and it's the kind of not letting go of it. And it's this really, like when you're trying to kind of do some work around it, it's like they're really digging into it. and really finding lots of data to support why they should hold on to the resentment. And you can kind of notice that, and and what it leads to is it leads them to kind of feel like the world is a really unsafe place. It's unjust. I'm not safe, and I've got to protect myself. So you really kind of notice like this really strong sense of, like victim stance kick in, where they are really set in that quite a bit. There's other things, especially I think when you see kids and adolescents, like when they're writing about the violence or they're drawing about the violence. Again, it could just be cathartic, could be something they're getting out. But I think, we do know that they're, again, for some, that's part of the planning process. I'm going to put pen to paper and I'm going to start thinking about this. And as they start to write about it, it starts to become more real in their head. So again, it doesn't mean everybody who writes or draws about something that's violent means they're going to be violent, but you got to check it out, which is why we try to educate teachers about that. And, anybody who's around kids or parents, like, don't just kind of rule that out as, oh, that's just, Sam being creative and him having a nice outlet for his negative emotions. It's probably worth a discussion about what that means. And that again, and who's oftentimes seeing those sorts of things? Well, it's not a mental health professional. It's a teacher, it's a parent, and it's sort of teaching them how to, maybe ask some, little deeper questions, but then also knowing how to refer to someone that can do a more full assessment of the person. I talked too about the whole leakage thing. That's a big issue. Usually somebody knows about it. Usually somebody has some information about the attack, or a planned attack. And whether that's because of something they've posted on social media, or they have a confidant, they have a friend who they've been talking with this about, it's rare that no one knows about it. Okay. What unfortunately happens in many of these situations is that person either is scared to go tell someone, or they think, well, I don't think they'd ever do that. I've known them for a long time. That's just them being pissed off. So it's teaching people, and I think, in schools and workplaces, we talk about this topic of bystander intervention and, the importance of teaching people to know how to respond to a variety of concerning behaviors, whether it's depression or suicide or threats of violence. Like, how do you help be part of the solution in the community you're living in when you see something that doesn't feel right?
I think this conversation about the community and the point you just hit on about teachers, parents, this exposure to these things beyond just us as behavioral health clinicians. And for us then, as the providers, knowing how to support others in an appropriate response. I can see as the other part of the equation. So it's not just us being in the room and saying the right things, asking the right things for that young person. In this case, we're talking about adolescents and young adults. But then also, like, how do we talk with parents or with teachers about, like, hey, this is what I'm seeing and this is what's happening and here's what needs to happen now. So when we're at the point where we do believe that this person is checking a lot of those boxes, then what?
Well, I think, if it's your client, then I think it's having to take the appropriate steps to inform the people that can either provide protection or get the person to a place of safety. And I mean that. I think when you talk, we have what's not talked about or put out in the media is that there are many more threats that are stopped than those that actually play out. And that maybe could give you a peace of mind or maybe scare you a little bit more depending on your situation. But the truth is we've gotten better at this, and we're able to be more responsive to threats now than we used to, because we have a system and a way of doing it. But I think it's just not being afraid to, just like if you were having a client who was suicidal. I think that's the thing I would challenge people to do is, like, if they were thinking about really seriously harming themselves, what would you do? You would call in other people. You would surround them with support. You may look towards hospitalization, or some other sort of, intervention. You may, and I hate doing it, but if it's truly like where you have a client who's out of control and you're starting to talk about this and they're becoming increasingly agitated, and you may need to call the police to contain the situation. Okay. I think it's probably rare that that's where it would have to be. But, again, sometimes when people are in a state of mind, where they're really kind of committed to doing what they want to do. I mean, the fact that they're talking with you about it, I would point out, is a good thing. Okay. Again, we sometimes talk about suicide ambivalence, and people kind of when they're talking about kind of both sides of it, like, in some ways that's a good thing, that they're able to kind of talk through that, and it means they have some questions about it. If they're bringing up this idea that they would want to be violent with some other person and they're telling you about it, there's probably a part of them that, has thought this probably isn't a good idea, and is open to some intervention, or they else wouldn't be talking with you. And so it's having to sometimes do the uncomfortable thing, which is, as clinicians, we're oftentimes, protect their confidentiality. I don't want to break trust. Well, just like oftentimes with suicide, there's sometimes you have to look sort of at the greater good, which is saving somebody's life, and deal with the other part afterwards, which is, might need to repair, your relationship with your client, which sometimes really does have to happen once you go through a crisis situation with them like this. But I'd rather deal with that later.
It sounds like one of the themes I'm hearing is just basically for clinicians to not be afraid of addressing things head on. Like, this is that there isn't much room for kind of dancing around it. It's to ask direct questions, and then to be clear in your clinical interpretation that there's now a higher need, that we need to do something. It's not just enough to discuss it, but then there are steps that we need to take as providers. It could be calling the emergency response team. It could be calling 911, and to not be too tender, I guess, in doing that. It's like sometimes you just need to be upfront and forward about it and address it head on.
Yeah. And I think the other thing I would recommend, like if this is maybe an ongoing client, is, you'd probably, and you feel like you've done everything you need to do, and you've created a safety plan to where, and you have a parent or other people that you feel like are on board, but you probably want to see them again pretty quickly and see if this was just sort of a transitory sort of heightened affective state, or is this something that is kind of setting in more? And so the follow-up and, really, making sure, you're just documenting very specifically the things you're asking, their specific responses to your questions. Again, you want to do that anyway in terms of just good clinical documentation, but it's also, you're protecting yourself too as a professional. If you're ever asked questions, did you ask this question? Because that's what they're going to ask you. One of the things I think as part of a good assessment is, the importance of, having a structured plan of how you're going to make a determination of what the person's risk is. There are, different guides out there. I'll talk about just two of them. One is the SIVRA, SIVRA 35, which was developed by the National Behavioral Intervention Team Association. NBITA is what that organization is referred to. And if you go to NBITA.org, you actually can access some pretty amazing resources. They make them available to folks under the resource section and the assessment tools section that can really kind of give you some guidance about, what are the items that you should be asking about. These are definitely developed specifically for kind of more school settings. But when you look at the risk factors, they're the risk factors that really would apply, even to folks in like a workplace setting. How you would maybe word the questions would be a little bit different. And so what you're doing there, again, there's what's a little bit different, I think, with this kind of risk assessment. It's not risk prediction. There's no way we can predict because, like, whether somebody's going to do it or not, or whether they're going to commit an act of violence. What you're trying to do is at least get some sort of gauge on how significant of a threat is this, and what do we need to do to reduce the threat. If we know somebody has a weapon, for example, we need a pretty strong intervention that probably would include law enforcement, and we would be working in conjunction with other people, and would need immediate action and so on and so forth. If we're dealing with a situation where, a kid is really, has been bullied a lot, is dealing with some depression, is feeling really isolated, and has made, some sort of comment about, I just wish these other kids were dead in the school. That's a serious comment, but there's maybe no real specific target. There's no real specific plan about how they're going to do it, and it's going to require a different level of intervention. So, that's going to definitely change, how we respond to the person. The other tool that is commonly, and I think is also a good tool, is referred to as the Waiver 21, which is the Workplace Assessment of Violence Risk. And it's developed to be used in workplaces and on campuses, and it's 20, whereas the CIVRA 35 is 35 items. The Waiver 21 is a 21 item tool that really, gives you some guidance about how to ask questions to be able to score that item. And with either of these tools, of course, these are things you need to get training in, and both of them offer trainings, throughout the country. But they're really important if you're a clinician. I think just being able to be able to notice what are the variables that are most important, that in terms of your assessment as a clinician, these are good places to start. Obviously, if you're kind of doing more like kind of work like I do, where somebody's been referred to me, by a workplace or school where I'm actually doing a really official threat assessment, then absolutely, you have to go and get more specialized training to be able to, really speak into these things. So, yeah.
So as clinicians, if we've identified that somebody has some risk factors, let's say that they don't have any specific identified victim, let's say, and that they have relative access to means, but nothing super specific. And we as clinicians are out of our depth. So it's like, let's pretend we even call the psychiatric emergency response team. They come and do an assessment, and they're like, this person is not, dangerous enough where we need to take them and do an involuntary hospitalization. When we know we're out of our depth, how do we then connect that client, assuming they're an existing and active client? How do we connect them with the right resources, and what would that look like? I mean, I'm at an unfair advantage in that I have folks like you in my network that I can call and say, hey, let's consult and then, potentially a collaborative relationship and work together. For clinicians that don't have that, how do they find people that know how to address this kind of stuff and basically not continue the plan as usual and hope that everything's going to be okay?
Well, I think just like we all kind of keep in sort of the Rolodex in our mind about other issues that are kind of outside of our scope. I think this is one of the things you do in advance. You sort of ask yourself the question, okay, so who would I call? And ask questions in your community or in your professional organizations about, who does this work. Another resource that you could utilize is an organization called the Association for Threat Assessment Professionals, which is a national organization. And you likely could contact them, and they have a list of people in the area that would have some expertise. Not everybody that does this kind of work is a member of that organization, but I think it's reaching out to the professionals, the organizations that have expertise in this kind of work.
Absolutely. Thank you for those resources for the people who don't necessarily have somebody that they work closely with that has a specialization like this. When we're talking about particular client factors that make somebody at higher risk, so it's not just their ability to clearly describe a detailed plan or obsessive thinking, let's say. But when we're looking at, hey, this particular demographic we see as having more struggles of this type, doesn't really exist with threat management. Differences between, are there socioeconomic factors that are contributing? How about gender? All of these different variables, are they that relevant for us as providers to know what they are?
Yeah, and I think the answer is, in general, we really talk about to be careful about any kind of profiling and sort of look like, well, this is a person who looks like somebody who's going to commit an act of violence, which is why it's really important to stay focused on more of the descriptors and objectively what we're observing and hearing, rather than kind of looking at, even though, of course, we'd be oblivious to say that, to ignore the male factor, that, the most shootings that we see are done by boys and men. But, again, it doesn't mean that there couldn't be, a younger girl or, young woman that wouldn't also have those thoughts. So it's trying, and as well, in terms of there's no real data in terms of the socioeconomic factor or race. When we look at these things, we see that people are all across the board. And so being very careful, I think people have an idea of what a violent person looks like.
Yeah, a profile, definitely.
And I would encourage people to kind of put that out of their mind, that's not helpful. What's more helpful is looking at more objective data and variables that we know are associated with violence, rather than kind of some of the easy, things of how a person looks or how a person, the content of how they talk is important.
I'm glad that we hit upon this topic, because I mean, harken back to Columbine, and then there was this whole thing about trench coats. That it was like, those are the kids that we need to be watching. And I think what you're saying is, don't get so laser focused on any of these particular elements, whether it's the person's gender or, just what group they're in. Are they popular or whatever it is? And don't let that blind you.
Right. And are they a good student? That's one I oftentimes hear. Well, they're a great student. They have a lot of future success and possibility. Well, the Columbine shooters were really good students. Okay, they were on the honor roll. So that's not, again, it's one of those things that I think, and I think it's one thing as parents that puts blinders on parents. Even though they might be seeing some concerning behavior, like in that case, like where they're looking up things about how to make explosives, and they have access to weapons, and there was knowledge about a lot of concerning things. But there was also sort of in their mind, well, my kid's going to school every day. They're getting good grades. It's learning to coexist with all the data and knowing how to respond, not over respond or sort of zero in on just the data that sort of supports what we want to see. And that's hard as a parent. You want to see your kid as a safe kid, and they would never potentially do that. But when you listen to parents of people who have committed acts of mass violence, they are heartbroken, and they are going back and, trying to put the pieces together. And unfortunately, in many situations, they do come to the conclusion like, oh man, I missed it. Or there were some things I should have paid attention to.
I think you hit on a really important point there. Is like we want to believe that people are safe. I think even for us as providers, it would be uneasy to be in a room with somebody and then even acknowledge like, oh my goodness, the person that's sitting across from me, I think isn't safe. And I imagine parents don't want to have that conversation with themselves either. Like, oh my goodness, my child could be a danger to others. There's so much more that we could talk about on this topic. One thing I know that, of course, that I learned in my master's program, heard come up, and on assessments, we ask, do you have a history of harming animals? Do you have a history of lighting fires? Are there any correlates there that really should be raising a flag for us on assessment, even if there's no mention of desire to hurt anybody else? Is that actually one of those things that we need to be listening to? Or is it one of the other pieces of information that just kind of we need to be screening and, as you said, primarily listening for what we're being told, not trying to file it away into some demographic information?
Yeah, no, I think you touched on a couple of variables there. I think especially with younger kids, are they not that, and we know that, of course, empathy is something that develops, over, many, many years and into a person's 20s. So it's being careful not to quickly, diagnose the kid as a, conduct disorder or a psychopath kind of thing early on. But it's being conscious of, what developmentally, like, normally, how would young children act around animals? And how would they treat animals? And if you're getting reports from the kid or the kids coming in and talking about how you hurt an animal, or the parents are telling you, yeah, he really, he did this awful thing to our pet, the light should go on. It's something's happening there. Does it mean they're going to commit violence towards other people? Not necessarily. But it means that, like, they're not sort of tuned in with how what they do affects other people. If they're getting school reports back that, they're doing pretty outrageous things, they're being violent or not following the rules, despite lots of attempts to kind of redirect and intervention, absolutely is a sign. I think definitely too, we do know, again, the majority of kids that get bullied never go on to commit acts of violence. So we can't say that there's this direct correlation between being bullied and acting out violently. And we do know that a large number, whether it's bullying or feeling excluded, or not kind of having their place or having a peer group or having, people that are meaningful in their life, is definitely something we want to pay attention to. I think it's like, as parents, like, people ask me, like, what do you do to prevent this? How do you prevent your kid from doing this? And, it's how do you develop, those caring traits in your children? How do you put them in situations where they begin to develop traits of empathy? If they are showing signs of emotional distress, being responsive to them early and not waiting and thinking they're going to outgrow it. It's really being attuned in and attentive to your younger child.
I like that you brought up not only the risk factors, but then the protective factors. Do they have caring adults? Do they have a network of people that are monitoring them? And that idea of feeling like you're part of the community. So balancing both sides of that then as mental health professionals too. It's not just looking for risk factors, it's also looking for protective factors as well. Robert, I know you and I could probably talk a very long time about this, and I'm grateful for you coming and talking with us a little bit about some of the things we need to keep in mind when we're considering someone's real threat level and what to do when we are out of our depth, and what we reach for. What are some other resources that you recommend? I know you mentioned NABITA, so NABITA is one of the national organizations involved in threat and behavior assessment. What else has been really helpful, and where can we reach for resources?
Yeah, I think the Association for Threat Assessment Professionals, ATAP, is what it's referred to, is a great resource. There is a model of threat assessment intervention that has been utilized a lot in more of the K through 12 model, which is called the Dewey-Cornell model, DEWEY, Cornell, CORNELL. That's out of the University of Virginia. It's actually a research group that has really worked to try to refine processes for schools and educate communities about risk and how to respond effectively. I think those are good starting places for someone who's looking to learn a little bit more.
Thank you. I appreciate it. And if listeners want to get in touch with you, what's the best way to do that?
Yeah, probably the easiest way is to email me. My first name, Robert, at roberttherapy.com. My website is roberttherapy.com. And so please reach out. I'm always happy to help someone if they're kind of stuck or they need a consult regarding, this kind of situation they're dealing with, or just provide some other resources for them, as they look to develop their skills more in this area.
Fantastic. Thank you so much again, Robert, for joining us. I think this has been really eye-opening, I know, for me, and I'm guessing for our listeners as well.
Great. Thank you.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.